You know, Dr. Castle talked about leaders, and one of those leaders right here in the state of Indiana is someone I get to work with every day, and I'm delighted to say that. I'm so proud of him. He's been such a great resource for our entire community during the pandemic. Dr. Yeleti, Chief Physician Executive at Community Health Network, is our next presenter. Dr. Yeleti was on call the night the first COVID-19 patient in Indiana came to the hospital. His leadership for our healthcare system and really for the entire state of Indiana has been incredibly helpful as we navigate these tricky waters. Dr. Yeleti is going to share what he's learned from the pandemic as a healthcare professional and as a leader at a major healthcare provider. Good morning to you, Dr. Yeleti.
Good morning, Chris. Thank you. And thank you, Patty and Dr. Cassell for your comments. And I would actually echo what a lot of Dr. Cassell has said today about the collaboration and the partnerships with the life sciences here in the state of Indiana. I think those collaborations and partnerships clearly have made a difference for our citizens and Hoosiers here. And I think we're doing much better than many other states because of what we've been able to do with the foundation set from BioCrossroads and other institutions to really make a difference. So I'm going to briefly just talk from a firsthand experience about what was like inside the hospital during those times. So Community Health Network is a system in Central Indiana. We have 8 hospitals, about 200 offices, sites of care, 15,000 employees, and 2,000 physicians. On average day, we see 10,000 people, 10,000 patients that walk through our doors on any given day. So that's kind of the background when we're looking at how do we keep things safe during this COVID pandemic. Back in February and March, we saw what was happening in Italy and New York City and Seattle, and we were starting to make our own plans as best as we could, understand the challenges that would come before us. I actually distinctly remember Friday, March 6th, we were at 7 a.m. I was in our incident command center, again, doing our preparations, and I get a call from the State Department of Health saying that the first patient was positive. It was a patient we sent to the ER the night before, and then we had a first case of COVID-19 in the state of Indiana. To be honest, I think I would not have expected since then that we now have over 156,000 Hoosiers who've been contracted the virus and over 3,000 that have died. At that time, I did not nearly understand the gravity of what's going to happen for the state or for the country or for the world. So when that March 6th phone call came, we activated our incident command center, mobilized multiple teams to get things in motion. You would think that all the plan in the world would take care of things, but there were a lot of major challenges that we just did not have control over. In particular, we had major issues with PPE, major issues with testing, and even things like ventilators and staffing. If you go back at that time, PPE, as you may recall, was a really big deal. We clearly did not have enough PPE, what we needed to take care of these patients. We knowing how deadly the virus is and how contagious it is. At that time, normally, an N95 mask would cost us 20 cents to buy one. Suddenly went up to $5.60, went up to $8 and $10 a mask. We didn't even if we could afford it, which we could, there were not enough masks around. So we had to become very ingenious in terms of what we were using. At that time, we told our nurses and physicians, use the same mask, take it home, use it for up to 2 weeks until the strings start wearing off, is what we had done at that time. We created what we call COVID units. These COVID units where we would cohort all the people that had COVID so that we could, again, restrict and best utilize the limited capacity for our N95 masks, as well as our gowns and gloves and face shields. We just did not have enough. And that took quite a while for us to get to the place where we can have enough. We didn't even know the value of surgical masks or even face coverings at that time. So it was really a very stressful time at that point. During that same time, testing was a really big issue too. In the state of Indiana, we're only doing 30 tests a day. That's all we had capacity for. Soon thereafter, thankfully for the leadership of Dave Ricks and Dan Skorowski from Lilly, they mobilized their therapeutic labs, made them diagnostic testing labs, and we were able to have more than about 2,000 tests a day to really help us navigate which one of our inpatients do have COVID and which don't have COVID. It was very, very challenging at that time. The other major areas we were concerned about was how do we take care of these 10,000 people that are walking through our doors? I had a phone call with one of my colleagues from Seattle, and what he was telling me is that, hey, if you're thinking about doing something or not doing something a couple weeks down the road, do it now. So I remember one Saturday morning we were debating whether or not we need to shut down our ORs, and by the next Wednesday we shut down 90 ORs. Here at Community Health Network, we do about 800 to 900 operations a week. We went from that to about 10 a day. And the reason we did that was multiple. It was a major decision. It affected thousands of cases. But first and foremost was the safety of our patients. We would not be able to adequately take care of them, not knowing who has COVID, who doesn't have COVID, and have enough PPE for them. Secondly, quite honestly, we need the ventilators. The rapidity of use of ventilators became a major issue for us. For COVID-19 patients, they could end up staying on a ventilator for 2, 3 weeks at a time, not 1 to 2 days or even a week for other illnesses. So we had 90 ventilators that we needed to use, and so we resourced them by closing down our ORs. Then we also have to look at other dramatic issues. What do we do with our offices? We have 200 offices. Is it safe for our patient to go through those offices? We made the decision to shut down our offices and keep our urgent care centers open. And eventually we closed the urgent care centers as well, primarily again to focus on the safety of our employees and safety of our patients. We turned on virtual visits. Many of you know we went from 0 virtual visits to thousands a day, more than we ever have. At that time, that made a lot of sense to do that. We figured that if a patient needs to be seen, they can be seen virtually and then get their testing done appropriately. These are rather draconian maneuvers we took at that time and took about 6 to 8 weeks to really get things settled down. The amazing thing was we had this incident command center. We had all these people, all hands on deck. And for about 10 weeks, every single day, we'd have multiple meetings all the time, reviewing everything we need to do to take care of our patients and take care of our employees, trying to make sure that safety was the first and foremost priority. If you recall back in April, the United States was having more than 2,000 people a day dying from the coronavirus. Even in our own hospitals, we were having between 10 to 20 patients every single day during the months of April dying from the disease. So it was really very traumatic from a well-being standpoint, and really caused a lot of burnout for our nurses and physicians. And recovering from that, but we're not through the woods with that either, but just very traumatic. Finally, I think through the month of May, we slowly started seeing the nationwide and statewide and citywide shutdowns beneficial, and seeing the case rates going down. And so probably by the right before the July 4th weekend, we finally had a nadir in the number of cases in our hospitals. We went from about 120 to 150 patients with coronavirus down to about 10 to 15. Unfortunately, since that time, the case rates have gone back up. We're up to about 30 to 40 patients in our hospitals right now with coronavirus. The one thing different I would say now, though, compared to back then, is we are much more prepared. And what I mean by that is we have ample PPE supply for several months. We do have much more ample testing. So between testing and PPE, I do feel that we can handle any future mini surges and take care of our patients as they come through. I don't anticipate we're going to be shutting down ORs or shutting down offices to the extent that we had to before. We're very well prepared. But one thing to keep in mind, though, is that we're still here for the long haul. This disease is not going to go away anytime soon. It's not going to go away in the next few months, probably not for the next couple of years. We're going to be using masks for a long time, yet for another couple of years. I recall back in May, we were debating how long to have our administrative offices closed. We were debating should it be June 1st or July 1st, and we said, let's keep it closed until January 1st. That seemed pretty draconian at the time, but clearly that's exactly what we need to do, and we still don't know when things are going to be opening up. So a lot has changed. I think the healthcare institutions have really learned what to do and how to work together with this, and we feel more comfortable as surges come forth. We still have a lot ahead of us. And in terms of kind of lessons learned, I think one of the biggest things we learned is in the face of this crisis, we're really able to pull together and bring together the humanity of all of us, and humility for what we do know and we don't know. And I think with that, there was a lot of ingenuity, innovation, and a lot of teamwork. And teamwork and partnerships clearly made the difference. Even within Community Health Network, we formed all these new teams we never had before. One of the things you do for coronavirus patients, you do what's called proning, where you turn them onto their stomach so they can sleep on their stomach. To turn a patient that's on a ventilator onto their stomach is no easy task. So we created these proning teams. Our orthopedic surgeons, occupational therapists became these proning teams. Intubation was very dangerous. And when you intubate a patient, they spew out a bunch of the virus. So our anesthesiologists created intubation teams and created new devices on how to protect themselves. The anesthesiologist looked at how we take ventilators, take one ventilator, and create new pipes so you could actually take one ventilator to be able to ventilate 2 or even 4 patients. So a lot of creativity that came aboard. Our surgeons, we created what's called central line teams, where they would go in and put in central lines for our patients that need large IV access for our patients. So a lot of teamwork really made a difference. That's in our hospital. But even statewide, I still recall on a daily basis, the CEOs of all the hospitals in Indianapolis and the CMOs of all the hospitals would be meeting on a daily basis, truly discussing what they've learned, what their capacity is, how many beds they have available, and how can we help each other and how we can make things different. So every single day for several weeks, I think that partnership was critical. And that was even just at the local site. Then finally, from a broader side, from all health life sciences, whether it be BioCrossroads or CICP, other organizations, all the executives would be meeting on a regular basis. the foundation set by Brian Crossroads and the life sciences here over the past 20 years allow for this collaboration and partnerships to really, I think, make a big impact. So I think the lessons learned is that we can get through this together. We will get through this together, but we also need to remember that we need to follow the science and take our time with it. Even when we're taking care of patients back in April, we didn't really know what we were doing with the treatments. We still need to remember that there's really no cure for this disease and really no effective vaccine yet. We have things that are coming through the pipeline, but typically, to really get the data and the data we need, it takes a couple years. So while we have some preliminary data, we still are far from where we're going to be to conquer this disease. So I think these partnerships that we have and all that you're going to hear today between all the life sciences is going to make a big difference. So that's the view from the front line, and I hope we will continue with the partnerships and make a difference for all of our Hoosiers and for the state of Indiana. Thank you.
Dr. Yeleti, thank you so much for sharing, and thanks for your leadership.